This segment is sponsored by VeinSolutions. Well, varicose veins can be more than just an embarrassing cosmetic problem. Here to talk about a comprehensive approach that VeinSolutions takes to treat varicose veins is my good friend, Dr. Jeffrey Apple. Good morning to you.
Good morning, Stephanie.
Well, I'm excited to get into this conversation because I have a lot of questions for you, so I hope you're prepared to answer them all. Let's get started with talking about, varicose veins and how, of course, they could be a cosmetic problem for some, but they could also be a medical condition for others. Can you explain that to us a little bit?
I can. Varicose veins come in all kind of shapes and sizes. They're very common. We see them very often after women have several children, men who stand for long periods of time. And the severity just depends usually on how long you've had them. Most people usually start to get varicose veins, which really all they are veins that don't carry blood up from our feet to our heart in an orderly fashion. They usually start in your 20s or 30s, usually get worse in your 40s, maybe your 50s. And people will seek treatment at different points in time, but usually what they're coming for is they can't stand for long periods of time, or the swelling in their feet and ankles has got to the point that their friends or their husband or wife is kind of calling them to get treatment.
The important thing here is to look at talking to a vascular surgeon when you're having issues with varicose veins, because it sounds like there's a lot to deal with.
That's right. They come in kind of all kinds of severity, and the first thing we do, we'll just kind of stop, take a look at the patient as a whole, and as vascular surgeons, we deal with all forms of circulation. So we look at the patient, talk to them, hear their story. We'll then get a complete ultrasound of their venous function here in our office, and then we'll kind of review that, talk to the patient, kind of come up with a treatment plan if they need it. The good thing about varicose veins, there's a lot of things we can do that don't involve surgery. We can talk to them about things to do with exercise, ways to elevate their legs, compression garments that they can use when they exercise or work. So there's a lot we can do without just jumping right to surgery, and a lot of people like that.
Well, while we're on that topic, I want to ask you about some of the latest treatment options that you've been seeing for folks.
Almost everything we do this day and age is done here in the office for varicose veins. As vascular surgeons, we do have the option to be able to go to the hospital if we need to. Those are usually involving other venous systems, what we call the deep veins. Those are kind of like the major highways. But just about everything we do is done here in the office. There's kind of two things I talk to people about that are kind of the main treatment areas. A procedure called an ablation, and we use a radiofrequency catheter, or another treatment called VeinSeal, which is very nice. It's been around about 5 years, and it's a medical glue that we use to seal off the vein. People love it because it's essentially painless. They walk right off the table and they can go run errands or go right back to work. And it really does a nice job. So we've been real happy with the results of that over the last several years.
Tell us a little bit about why VeinSolutions is different.
Well, VeinSolutions is one of the oldest vein clinics here in Central Texas. We've been here almost 20 years, and our surgeons are all board certified vascular surgeons. What makes us different is that we have experience with the treatment of arteries, veins, and all the circulation systems. We specialize in treatment of varicose veins, blood clots of the arms and legs. We also specialize in removal of what you hear about vena cava filters, which occasionally we have to perform. But we take a comprehensive approach. We meet the patient, spend time talking to them, hearing their story, do a complete exam, and then we do a nice thorough ultrasound here in the office. That ultrasound will tell us where the faulty veins are, and then we can give the patient a nice treatment plan that they can kind of coordinate with their schedule.
Dr. Apple, thank you so much. I really appreciate it.
You're welcome. Thank you.
VeinSolutions has locations in Austin and Georgetown. To learn more about their cosmetic and therapeutic vein care solutions, visit their website at VeinSolutionsAustin.com. This segment is sponsored by VeinSolutions.